Breaking news, President Biden testing positive for COVID, and we are told that he is dealing with, quote, very mild symptoms. We've gotten several updates throughout the day. NewsNation correspondent Kelly Meyer leads us off tonight from the White House. And Kelly, what else are we learning about the president's condition?
Well, Natasha, the White House says the president is doing fine. The White House COVID coordinator telling reporters today that the president has been so busy that he didn't even finish his breakfast this morning, although he advised that he should. The president is isolating in the White House residence just behind me for at least the next 5 days, waiting for that negative COVID test. And the president has really been kept in a bubble here, those visiting him having to test before they meet him face to face. The White House saying that shows just how no one is immune from this virus.
Hey folks, guess you heard this morning I tested positive for COVID.
In a video filmed from the White House balcony, President Biden telling the country it's going to be okay after testing positive for COVID this morning.
I'm doing well. I'm getting a lot of work done.
The president saying he's keeping busy this morning, calling the Democratic lawmakers he was set to meet with today in Pennsylvania before canceling his trip back to his boyhood home. A letter from the White House physician says Biden had a dry cough last night and other symptoms this morning. Today, Biden aides clarifying the fatigue started last night, and this morning the president had a runny nose and a dry cough. The White House physician revealing he prescribed the president Paxlovid, an antiviral pill, to provide additional protection. This is the first time the 79-year-old got COVID. He's fully vaccinated and double boosted, his last booster shot on March 30th of this year.
His risk of serious illness is dramatically lower. He's also getting treated with a very powerful antiviral, and that further reduces his risk of serious illness.
The president is fresh off his trip to the Middle East, fist-bumping the Saudi crown prince last Friday. And just yesterday, he was in Massachusetts, traveling with members of Congress and staff. So far, other members of the White House are testing negative, including the First Lady and Vice President Kamala Harris.
We knew this was going to happen. As Dr. Jha said, when he joined me at the briefing, in the briefing room not too long ago, he said, this is everyone was, at some point, everyone's going to get COVID.
While Biden's infection is potentially serious, it isn't the same risk the previous commander-in-chief faced. Former President Donald Trump testing positive just before the 2020 election, before vaccines were available. Trump spent several days at Walter Reed Military Hospital in Maryland before returning to the White House.
And now I'm better, and maybe I'm immune. I don't know.
Biden will be isolating at the White House for the next 5 days and won't return to daily life until he has a negative COVID test. The First Lady isn't set to return to the White House. Doctors will continue to monitor the president's condition.
It's unclear how and when the president was infected and just how many people he came in contact with in the last several days. The White House saying they are beginning contact tracing now and that they will keep us posted daily on the president's condition. Natasha?
All right, Kelly Meyer, thank you. And for more on President Biden's diagnosis and the treatment he's receiving, we are joined now by Dr. Timothy Quinn. He's the medical director at Quinn Healthcare. Doctor, thank you for being here.
Hey, thank you for having me.
And we can only assume that President Biden will be receiving the most advanced care available. Can you give us an idea of how his doctor is treating him now and also what the doctor will be looking out for going forward?
Well, right now, it seems that the treatment is right on course. He's receiving the Paxlovid. That's the new antiviral that's specific for coronavirus, and it's very effective. Mainly, his physician will be looking out for symptoms. And so far, his symptoms are very mild, which is a good sign. But because of his advanced age of 79, he'll be watched a little more closely than maybe somebody that's a little bit younger. But the fact that he's been vaccinated and boosted, that's definitely in his favor.
Well, I absolutely want to ask a follow-up on that. You know, it's not clear which COVID variant the president tested positive for. The CDC is saying the BA.5 variant is making up the majority of new infections now. And President Biden in his message was very clear this morning. He got both vaccines. He is double boosted. So what would you say to Americans who are maybe on the fence about getting their booster and they point to this and say, look, it didn't end up offering protection?
I advise all Americans, as I advise all of my patients, follow the science. Look at the data. And overwhelmingly, individuals that receive their vaccinations and their boosters, if they do contract coronavirus, which they can through a breakthrough infection, typically they fare much better. There's much less of a chance that they'll end up in the hospital and or losing their life. So getting vaccinated is the best thing you can possibly do.
We hear you. And can you tell us more about Paxlovid? We know it's made up of two parts, a medication that actually boosts levels of other antivirals, and then also a drug that inhibits the enzyme that viruses need to replicate. So many people who are testing positive right now, they want to get their hands on it. It can be really hard to come by. Why should only certain populations be using it? And is President Biden obviously in that group?
Right. Well, it's all about supply and demand. And right now, there's a very high demand with the coronavirus pandemic picking up so much. So what the community, what the medical community is trying to do is make sure that the people that need it the most get it. And those are the people that are typically more vulnerable. These are your individuals that are older, 65 and older, that's the most vulnerable age. And then those that have chronic medical conditions, especially lung conditions such as COPD, heart condition, kidney conditions. So what's being attempted is to try to allocate those medicines to that population first so that we can have the most effective defense against this coronavirus pandemic.
And in terms of it being effective for all of us, no matter what population you're in, if I can put you on the spot, Dr. Quinn, if you were to receive a positive diagnosis, would you seek out Paxlovid?
I would. I'm 49, but I'll be 50 years old next month. So I'm right there. But also because of my occupation, I'm a physician. I'm exposed to a lot of individuals that are vulnerable, a lot of senior citizens, a lot of people with chronic medical conditions. And I want to do everything I can to be as well as possible to care for them, but also getting those vaccinations, wearing those masks and all the mitigative measures so that I have less of a chance of contracting coronavirus, passing it on to my patients.
Absolutely. Dr. Timothy Quinn, thank you so much for speaking with us.
Thank you for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.